And our top story, the United Nations has pledged 6 billion rands towards ending the AIDS epidemic in South Africa. Now, this was revealed at the 21st International AIDS Conference taking place in Durban. South Africa has the world's largest population of people living with HIV. The funds will help expand the antiretroviral program, which provides treatment to more than 3 million patients. And for more from the conference, we're now joined live by our reporter Ayanda Mhlongo. Ayanda, very good afternoon to you. I mean, it's day 3 of the conference and 6 billion rand has already been pledged by the UN. Do tell us more about the developments in Durban.
A very good afternoon to you, Alicia. Yes, absolutely. But it seems, Alicia, it's not enough. We've just also learned, and some of the discussions that are dominating this conference is on funding, and there is already reports that donor countries are pulling their funding from middle income countries, which is quite a concern considering the fact that a drop in funding will threaten the global AIDS response. And the news of a drop in funding also comes at a time when AIDS efforts and AIDS services needs to be scaled up so that countries are able to meet the global AIDS targets. But to talk more on funding, I'm joined by Mr. Matthew Kavanagh from the Health Global Access Project. Matthew, good afternoon, and thank you very much for joining us. Funding, it's a huge concern. And just going through one of the briefs on the session talking about funding, it was stated that it's at an unprecedented in the history of AIDS response, this drop in funding.
That's right. So for the first time, we saw 13 of 14 major donor countries decrease their funding for global AIDS. This hasn't happened before. We've seen dips before, but this time, for the first time, after really significant increases, donors have actually decreased their funding. And this is shocking because what we see right now is that donors, countries, leaders are running around the world, and what they're saying is we can end AIDS. In fact, we were just at the United Nations, and their countries all pledged to work together to achieve 30 million people on treatment and an end to HIV by 2030, and yet this drop is unprecedented, and frankly, it's shocking.
Matthew, speak about the middle-income countries for us to understand examples of these countries and why specifically are these the donors pulling out of these specific countries.
So part of what's really hypocritical is that you see these donors that are saying we don't want to fund middle-income countries, meaning countries like South Africa, countries like Brazil, India, China, that have reached middle-income status that are no longer the poorest of the poor countries. What they're saying is countries can do it themselves. But what we know is that actually HIV crosses borders. HIV is a global problem. HIV is something that the world has committed to end by 2030. That won't happen if donors actually pull back. There's no way South Africa can get 6 million people on HIV treatment as rapidly as is needed, and yet that's what donors are proposing. Luckily, we're beginning to see a reversal of that. And actually, in South Africa, there was a plan to pull out money from the United States government that they've now reversed, which is actually a very good news that they've changed that thing going forward.
And just for a person to understand that, of course, pulling out money in such very critical programs could hinder prevention programs, worse off compromise treatment and care of people living with HIV.
So that's the hypocrisy, is that you've got donors who are saying, donor countries, who say we can end AIDS, we're going to end AIDS, and yet we're pulling back money. What this is going to mean, if it happens, if it continues this way, is that we'll see treatment programs, prevention programs running out of money, not able to expand. For example, already what we're seeing is that immediate antiretroviral treatment for everybody, we know stops the virus from being transmitted, and yet that's only rolling out in some places, in some countries, even in some countries, only in some districts. This is shocking, and it's frankly a violation of human rights. The helpful thing, though, is that we've reversed this before. So remember in 2000 when we were in Durban, there wasn't donor funding for AIDS, and now there's $19 billion. In 2010, there was a slight dip in HIV around the economic crisis, and it went back up again because of political will. We think that's possible. It's not inevitable. It can be reversed.
Moving forward, I mean, you're saying that there has been some reversals, which is great news, but then how are we going to, what is the plan moving forward? Where is the funding going to come from?
So the gap in funding, according to UNAIDS, is that we need about $7 billion additional dollars. Now, right now, the world is spending $19 billion on HIV in low and middle income countries. That's a huge increase from the past, right? And that's a combination of national governments putting in money, donors putting in money. all have to work together to make that happen. $7 billion is frankly a drop in the bucket for global budgets around the world. My country, the United States, we spend more on drones to do warfare many, many times than we do for HIV. It's a drop in the bucket and it's entirely possible. The question is, will the political will be there? I'm hopeful that Secretary Clinton will become President Clinton, and if she does, perhaps she'll actually put in the money. Either way, we think it's really possible, but there's going to have to be some real political movement that holds leaders accountable. We cannot just stand by and watch leaders make promises on one hand and let people die on the other because they don't want to fund it.
Matthew, thank you very much for your time. Matthew Kavanagh from the Global Health Access Project, or Health Global Access Project. Alicia, still a lot to talk about. As you see, lots happening here at the 21st AIDS Conference. We mentioned yesterday that Elton John will be in the country, and he has arrived indeed. He's actually in one of the townships just outside of the city of Durban, Umlazi, and he'll be coming through to the conference as well. So we're looking forward to be hearing from him. Also coming up, we'll also be discussing another issue that has been discussed and been dominated as one of the discussions here at the conference, and that is stigma and discrimination. We'll leave it there for now, Alicia, and it's back to you in studio.
Thank you so much for that update. Ayanda Mhlongo live to us from Durban at the 21st AIDS Conference.